Well, Stan, good morning.
Good morning. Good seeing you.
Yeah, how's the morning going?
Going well, as usual. Start off with safety huddles and launch the day.
Yeah. Well, hey, first and foremost, really appreciate you taking time out of your day. I know you're a busy individual leading Olathe Med. I appreciate you agreeing to do this. I think the goal of today, as we talked about, is really to just talk about Olathe Med, healthcare as a whole in the region, and what you're seeing from your role as a leader in healthcare, especially in Olathe in the region, and what you're talking to, or the conversations you're having with other leaders in healthcare and how it relates to the communities. So again, thank you for doing this.
My pleasure.
I know you're about to turn 2 years old here, I think, because I think last time we sat down at a panel, you just turned one at Olathe.
It's been
was it
ago.
November, right?
Yes.
So I got to imagine you got somewhat of a new leadership team, C-suite. 2 years, 1 year just hitting your stride, and then pandemic. I got to imagine it kind of gelled you guys together. It brought everyone together. Is that, if you don't mind talking about leadership and how that played into
absolutely
working through the pandemic?
Prior to this pandemic, with my healthcare career, I've been in situations where we've had tornadoes close to our acute care facilities. I've had direct hits 2 weeks apart from hurricanes when I was an executive in Florida. And anytime you have to rally your teams on incident command to really have an intentional focus around such a major activity, it absolutely bonds your teams. Not only bonds us with all the players that are part of incident command, but as you have the opportunity to go out and talk to the frontline caregivers and our providers and our staff, and those that a lot of times individuals think, okay, frontline caregivers, but just the amount of efforts from our support teams and our ancillary teams to make sure our frontline caregivers have what they want is something that was absolutely special. Those encounters, all of us look at each other, and that bond is going to be stronger than ever. And I look at that from Olathe Health system across our 2 acute care facilities and all the clinics that we have and all our different access points of care. But I talk to our peers, as you were describing, the CEOs of the other systems, and we all have that special little flicker in our eye about how each of us have responded to this in such a positive way that will make our organizations stronger for the future and also have that special moment with what we've had to go through with pandemics.
Yeah, well, I know I have the benefit of knowing a lot of those individuals, and they would echo what you say, so Thank you again.
You bet.
You're on the heels of opening the new surgery center and the pharmacy. What's that going to mean to the community in Olathe Med as an organization?
Anytime you have the opportunity to expand your service offerings, it's exciting. Not only just internally, but we know what that means for our patients. Patients that either we're choosing care outside of our communities for the expanded service offerings we're going to have, or those that have come to us loyally for many years, being able to go into places that they know will be state of the art. And then internally, this is an expansion of both our OR, so it's not that you normally have patients horizontal walking around in ORs. You're normally in those suites under anesthesia, or in our pharmacy, which is normally a very secured department, as you can imagine. So two locations that a lot of times the public are not going to be forward-facing. But we had tours today with our advisory council members in our community. We've had multiple tours for others to see it, and the overwhelming response has just been so excited. We're going to be adding over 17,000 square feet in our surgery department. And as you and I have toured it together during construction, it's always amazing that the square footage that's required in today's environments, in any environment that you might have in the acute care setting, in your clinic settings, or in particular, you go into some of those rooms, as we've talked about, and it feels like you could put skates on to get from one side to the other when it's empty. But then when you start adding robotic technologies that we have, we acquired our second robot just this last year, and we look at our booms and our monitors and our control rooms for a hybrid OR. When you start adding the equipment and all of that technology, it's amazing how quickly the square footage fills up. But as you talk to our providers and our staff and our surgeons, our anesthesiology teams and our surgical teams, our pharmacy teams that'll be on the second floor, just incredible excitement for what that means for them. They've toured it, they've looked at it, they've given us input on design, as you know, because your teams have helped us hear the voice of the customer of what their needs are. In the pharmacy, they've actually doubled in size to what they originally had. That's a pharmacy department that's been in place for over 30 years. So you can imagine, to double your size, we have pharmacy residents that flow through there. A lot of people may or may not know, but in our healthcare environment, there's a lot of expectations on compounding medications, and there's new federal expectations. And I used to use certain numbers, and those numbers have already changed on what they call it. What's nice is where we might have been lagging in the past with the 30-year-old pharmacy, we were meeting all the standards, but not in the optimal way. Now we're leading. So having the ability to advance in those technologies has been outstanding. And then another example is our vascular surgeons on the hybrid OR. I've talked to them over a year and a half ago about certain procedures that they don't have those patients stay close to home, and they simply said, once you have the hybrid OR, those patients will stay closer to home. So that's just one example of what that type of investment will mean to our community members.
Well, that's great. I can say from our perspective, and you mentioned it, having those individuals who are going to be utilizing the space, I call it an active owner, being a part of the design and the construction has been a huge component of the success of the project. And I think everyone in healthcare should welcome that experience, because if you don't have that active owner, you're somewhat constructing and designing in the blind. And that can lead towards a different outcome on a project. But you guys have definitely been an active owner, and we've loved that experience. So thank you for playing that role.
And if I could humbly just add, we know that this is not something your teams normally like to hear, because you like to have everybody sign off on those designs in advance and have that partnership. But as we walked through some of those areas earlier and let some of those end users see it in live environments, there were tweaks that needed to be made. I know that's not something that you probably want to share with everybody for your future clients, but the fact that you had that flexibility where we had time to do it, kudos to you and your team for allowing those end users to plan something first, but then when they saw it live to say, hey, we'd like to tweak this or that, and your willingness to do that was advantageous, so thanks.
Well, just look at the environment. I would like to think that the surgeons in there, they go in with a plan. I'm going to guess they have to tweak a few things every once in a while when they're in the middle of a surgery. It just comes with the environment, so we like that experience.
Good.
So 2 years in almost, just talked about the surgery and pharmacy project. What's the future of Olathe going forward, if you don't mind sharing?
Every health system I know of is continually focusing on, cost, quality, and access. We're no different in that triple aim of where we're headed. And obviously you look at artificial intelligence now and better data, the customer experience, how all of our patients are looking for a different experience and being innovative in what we're doing. The strategies for what you need to do to take care of patients in the acute care environments for higher acuity will be part of our strategies. In addition to that, as we look at the ambulatory environment, we're already in 5 counties with our primary care and specialty care providers. And strategically, we know, and our board has approved and authorized that direction to continually expand that footprint in our ambulatory environment. And, affiliations and alliances will be part of our future. As we remain independent, that's a strength of Olathe Health. We want to continue to be an independent system. But growth is definitely part of that formula. We just came out of a strategic planning session this week where last year my team and I put together a 4-year strategic plan. We have our focus areas, our objectives, and then where do we want to be 4 years from now? We modified and updated that this year. Really, it was a tweak. I think one of the comments that came out of the strategic session was that our board members were pleased that even with the pandemic, we still are moving in the same direction strategically that we had put together a year ago. When we look to investments that we're going to have, the board is fully supportive of future needs. So while we can't share with you those today, just know tomorrow. Just know that Olathe is very strong. The health system has a great vision and strategies for the future, and full support of our boards for the direction we need to head.
Well, that's great to hear. I'm curious because you talked about 5 counties. I mean, that's a big reach.
Yes.
Technology. How is that going to play into the vision? And even more so, telehealth, reaching out in those communities, especially in a pandemic world to where people don't have to travel here. If you don't mind touching on how that's been a component that you've implemented, and how that will play into the future of your vision.
It's interesting. Pre-COVID, we already had strategies to move into the telehealth, telemedicine technologies. Patients demanded. we need to embrace it. We did. What's funny, though, is you have your normal plans of how fast you want to implement telehealth in particular. And with government regulations, there really was a pull down of how fast health systems could implement telehealth. But when COVID hit and the federal government said, we are releasing these constraints, you go focus on what you need to do to take care of patients, we did something that I would, and my team always shares that I'm always pushing a little farther of where we should be and can be at a pace that I've always got to monitor, because there's always that speed of implementation and making sure your culture is not damaged by the speed for which you move forward. But we did something that was incredible. In a 2-week period, we had the ability from our IT and technologies, our physician engagement and embracing the change, to implement telehealth capabilities across all of our clinics in the counties that we're in. That's normally was predicted to be a 9-month process. So if you think 9 months into 2 weeks, wow. It also gives you, of course, they're like, now Stan, don't expect that type of intentional focus where we can make that type of move.
Always.
But when you look at it, it's just incredible when we can get everybody aligned behind what that needs to be. It was already part of our plan before COVID. It's definitely going to be something we continue to do. Patients expect it, patients demand it, and all the time in all healthcare systems, we have to reflect that while healthcare is catching up on technologies, all we have to do is simply look outside of healthcare and say, what do we demand as consumers of other capabilities in other industries, and just look at it and say, shouldn't patients and their visitors and the consumers of healthcare receive similar or better than that when they access points of care in healthcare? And we agree, they should, and we've got a lot of innovative things on the forefront. Same example or a related example, we, before COVID, were looking to launch Spot Saver. It's the ability that the app, you can actually, if you have a clinic appointment, you can tell us where you're at tied to making your appointments, and vice versa. Tell us when you're ready for your appointment. You can do it from the convenience of your home, your car, et cetera. You don't have to sit in a waiting room waiting for your appointment. We already had that in the plans in the works before COVID. Conveniently, 2 months into COVID, 3 months into COVID, we launched Spot Saver. Spot Saver allows our patients and their caregivers to really wait in the comfort of an environment to where, from their mental capacity, they don't want to sit in a waiting room during COVID with other individuals. Some do. Confidently, we obviously require all the normal PPE and safety precautions for that. But anybody that says, you know what, I don't want to wait in a waiting room, we have Spot Saver that allows them to come right into their appointment at that time. So technologies, we have embraced it. We embraced it before COVID. It's been at a rapid pace since COVID, and it'll be with us ongoing.
So, we sit in a waiting room, an empty waiting room right now, right. Socially distanced. Do you think the future of healthcare will ever go back to what it was?
No.
So these apps, for my benefit, I've got a 10 and 8-year-old. I would feel much more comfortable utilizing that app. We have utilized it. I'm happy to hear that, but I also look at the construction and design of facilities. Right now this space is underutilized, and you're paying to heating and cool it. So I would assume there is going to be some adjustments in how a campus works. Do you agree with that?
Absolutely. And so I just mentioned investments we're going to have in growth strategies, but how the design is tied to what those growth strategies are going to look like absolutely have transformed and will transform for the future. With those things in mind. Technology, what's an expectation on the experience? What's it look like outside the walls? When we look at our mission, it's 8 words, and I, of course, focus on that all the time. I think I probably mention it 5,000 times a year. Part of that is to make sure everybody knows what it is, but it's to help people through healing, health, and happiness. To help people, it's great because all of our associates, we have over 2,500 associates in the health system across these different locations that we provide services. When you ask them, why'd you get into healthcare, they said, likely to help people. Through healing is what we do inside our walls. Through health is what we're doing outside our walls, and population health and wellness, keeping people well, as we also, that ties to the navigation toward value-based care and our outcomes for patients. We need to have that strategy on the ambulatory environment. But what that looks like includes transformation of what the design of the buildings look like, but then what's it look like where you don't have a building at all? And do I ever think that there will be a we will cease building and developing. No, there will always be a place for that, because as we have
Thank goodness.
I figured you needed to hear that too.
Thank you, Stan.
But there will also be new niches that we look at that are going to be caring for patients in environments that aren't traditional. And then you look at the new entrance into the health environment. Those are technology companies. There are technology companies that are entrants that really become our new competitors, as we were talking about earlier, as opposed to our traditional competitors. Well, to compete with them, how are we going to lift up utilizing technologies and information to, one, reach the patient in ways that they want to be reached, and then two, providing the services and outcome that they expect.
You talk about the population health in the community. Like I said, I have a 10-year-old and an 8-year-old, and I just got the best email in the world that they're going back to school in a couple of weeks. How has you and your team, the leadership of Olathe, played a role in the school districts managing that plan, if you don't mind? What's the relationship been?
First, and I have to also include not only Olathe School District, but what we do down in Miami County as well. We've got partnerships with our school districts where we have our acute care facilities and many of our clinic sites. It's been outstanding. We've had a long tenured relationship with the Olathe School District. I'll use that as our example. Matter of fact, the superintendent of the schools is actually on our board. Okay. And when we got hit with our impact of COVID in the early days, they canceled school. So go back to the springtime. I know it seems like a long time ago, but when we were communicating with them, they said, "Is there anything you need?" And the compassion, love, and energy that we felt from the school district on, tell us what you need as a health system. We're out of school for the rest of the year. They brought us over 3 pallets, for example, of hand sanitizers and things that would help us. They actually had other groups that helped make masks for us. And so that special receipt of their care and love from us was part one. Part two, they're going back to school. One of the things that we look at is there's a need now they have for their school nurses, and partnering with them, we actually do some funding for them on mental health and behavioral needs for counseling for their school nurses and their teams, but also preparing them for things they may need that we can provide from a health system perspective. That collaboration, I have a long list of things that we could look at that goes very deep and wide for what that partnership looks like between Olathe Health and Olathe School District.
You know, something we were talking about earlier this week, and you just brought it up, mental and behavioral health. Obviously, this pandemic it's played a major role in the livelihood of families. It's changed the dynamics. And what are you seeing from that side of it, in the growth of it, that the pandemic has probably accelerated? I mean, if you don't mind talking a little bit about that.
Actually, we just talked about that with our physicians this morning on a call too. Matter of fact, I'll start with that just to give you a sense what some of the things we're doing internally, and then how that impacts what our focus will be with the school district. But just this morning, we had one of our lead providers say, we're going to reach out to our physician providers and our advanced practitioners on their health and wellness. There's articles in those professional journals about what this has meant to all the healthcare professionals and their mental health and wellness. And so they're going to be putting together tools for them. We also recognize that that's the same thing we need for wellness for our own associates. And really all businesses need that. We're focused internally because, being on the front lines with all that bravery and dedication of caring for patients from minute one through the pandemic, we need to reflect and make sure we're providing the wellness services for our own teams. Now you go out and look at where are other community partners, and we've spoken with many of them. And here on this site, at this campus, we have over 250 acres, and we've got a lot of partners on this campus. KBC is one of them, and they're in multiple states. Their national headquarters is on our campus. We already partner with them for behavioral health needs for the acute care setting. They also partner with our local communities. We have something that all not-for-profit health systems do, which creates a community health needs assessment every 3 years, and from that we create a community health improvement plan. Before the pandemic hit, the number one focus and this is bringing in community members, our fire departments, organizations, school districts, to say, what can we focus on as a health system? The number one thing was mental health and wellness. Now you've put on top of that COVID. Now we look at the impact as you were describing. What happens when these children aren't in school, to their home environments, what it means to their connectivity to others, what it means for our teachers, what it looks for what that means for the interruptions that means for them, the fears they have, the connectivity that they're missing on the passions that they have to care for our students. All that to say that we are partnering with them, as I mentioned, on the counseling side of things, but we also are partnering with them on other resources that we may have that can help them achieve the balance of first identifying and making them aware of when people might be in depression. A connected example of that is inside our health system when family members come to our clinics for wellness visits. So if you're coming for your annual health and wellness visit, we've now triggered in that checklist a question about depression, and we do that for ages 12 plus. So kids 12 and over, if they're here in our clinic settings and they have a wellness visit, we ask questions that connect to depression. If those questions are answered in the positive, we have the resources and tools to help trigger connections to our community partners. If you were to say, do we have a great plan for behavioral health across the county, the state, and the nation? No. I think every county, state, and nation, or nationally, it's a big deal. It's going to be bigger for all of us as how we're going to manage it. But the best way to approach it is for us to interconnect and take the best practices from organizations that already exist and make sure that we're giving them the resources they need so that, one, we know be aware of it so that we know that they exist. And number two, how can we help support them for that connectedness that we can utilize those services in the most proficient way?
Yeah, there's no silver bullet, and
Right.
I think it starts with awareness for sure.
Absolutely.
We all of us in our day-to-days just have to be more cognizant of it's a different environment we're living in for sure.
Agreed.
So staying with the community, diversity amongst all of us is more, especially here at Olathe, is more than just a language barrier. There are gender, religious beliefs, a lot of things. I'd love to hear what Olathe is doing to really enhance diversity inclusion and how you manage that process here.
Diversity and inclusion is paramount in our mission, our purpose, our policy statement on it, and we really want all individuals that become part of the Olathe family across our health system to feel included, to feel safe in an environment that fosters their ability to give us their best and have a joy of work. We always talk a lot in our culture about making sure you have a joy of work. If you have conflicts in inclusion, diversification, we need to address those things because the key to our success is we all come together. You mentioned gender. Inside healthcare, it's a little unique. I'll use that as one example. Yeah. We're kind of the opposite in the healthcare industry than what you see in other industries.
I guess you're right. Yeah.
We have about 80% of our workforce, approximately. Someone's going to say, Stan, it's 83, or approximately 80%.
We won't hold you to it. No fact finding
I'll use
on
the
this. There are no fact findings, I
But
promise.
approximately 80% of our workforce are female. And then you even say, well, what's your leadership look like? If you think of all of our leaders from charge nurses, supervisors, managers, directors, and above, females are double the amount of leaders that we have over the males. And so in our environment, when I hear other industries struggling with fairness and equality from a gender perspective, it's so far removed from my whole career because I went to undergrad, graduate school, right into healthcare, and it's been that way. So then you also look at, okay, beyond gender, that seems like check the box for healthcare on that. What about the other elements? And I think from our perspective, the key is just embrace the differences people have. And I will reflect very quickly that when I observe our new hire orientation, and I speak in our new hire orientations, setting the culture and the tone for our organization, one of the things that we find is that our HR executive talks about unbiased or unconscious bias, things that people come from their experiences in their past that they have, and he makes that a challenge to the individuals in the room to go past their unconscious bias. And he'll actually ask them, instead of it being top down, here's what we expect, we set the tone what we expect, but then we say, what's that mean to you? What could you do differently from your perspective to be open? And every time he does that, and I have a chance to observe it, our teams get it. Our teams get that they have to listen to others, treat them fairly, make sure that they treat them the way that they'd want to be treated. And then it's amazing because you can almost feel that unity start occurring even in just your new hire orientations. And then we talk about it in other environments as well to make sure that everyone knows that everyone will be treated equally, to where you really don't look at, it's diverse, and diversity should always represent our populations. But the euphoria is when you look at people for the value they add. The one most perfect comment ever out there is Martin Luther King's. When you looking at people for who they are and what they can accomplish, as opposed to the color of their skin or any of the other things that you look at that really make us all special, but at the same time you need to elevate your mission as any organization.
I appreciate that. So, Stan, we've talked a lot about, the pandemic and the state of where we are now, but last question, what's this shining light, the beacon of hope, the silver lining? Where do you see, unless you're going to tell us, some information on the vaccine is coming out in 3 days, I don't think you have that answer, but what do you, as a leader of Olathe Health, what are you telling your team and you're telling the community? Here's what's coming. Here's what we have all to look forward to.
So I'm going to go deep thought for a minute.
Yeah.
Top of mind that just came to me, and from this window, I actually looked towards City Hall for Olathe. A strong friendship that I developed with Mayor Mike Copeland. Many, many times he talked about unity, and a lot of the things that he shared with connecting communities and unity. Taking that reference to what happened to us through COVID, the amount of love, compassion, and unity that transformed from what we saw community members sharing towards us with the cards, the drive-bys, we had a flyover, our teams felt that. And then now that we are more stabilized with our PPEs and our cadence of staffing, space, supplies, and standard of care, what we can do to help prepare our communities for the future, I would just share with you the silver lining is for us to continue to focus on love and unity for who we are and what we can provide externally. And the future is very bright. While I know we're in a lot of times where there's a lot of disruption, there's a lot of concern, there's a lot of fears, I can share with you that from my seat, our ability to push through that, our ability to look to the future is very bright. And as I talk to our peers, our CEOs in the metro area, CEOs I know in other states, all of them, are there challenges? Everywhere. Are there things that could pull you down to say, I don't know how we're going to get over that hurdle? You could. But my team would always tell you that my cup is not only half full, many times it's full. Sometimes I've been known to be over-optimistic, but I've lived my whole life that way, and when I look at and reflect on that, it's always turned out in a positive way. So I would just say that the future is very bright. There are a lot of things we'll work on. There's a lot of strategies, tactics, initiatives we'll have. There's a lot of alliances, partnerships we'll have with the organizations around our communities and even other healthcare systems so that we all rise together for the occasions that might be unforeseen for the future. But how we responded in the health systems in the metro area, how we responded to the community members is just a great example that we can do a lot of things together.
Yeah, well, that's a phenomenal answer. It's very inspiring for me, and I hope everyone who listens to this. It's as we sit here in your your birthing center and we see
action,
the future of society coming about. It's just exciting to hear those words from a leader of this organization. So, Stan, I really appreciate you taking the time today. This has been a great interaction. I love your thought leadership on healthcare in the community, and again, just thank you very much.
Daniel, my privilege. Thank you very much.